Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering pharmacology, but to be specific, I'm going to be covering respiratory medications, okay? So if you have a test coming up, a quiz, exam, or you just need to brushing up on your respiratory or meds for the respiratory system, you're in luck. If you haven't done so already, guys, please don't forget to support this channel. I would love for you to like and subscribe below. Don't forget, guys, I also have other videos and contents that I cover on TikTok, Instagram. My handle's still the same, Nexus Nursing, and I also have audio lessons available on my website, nexusnursinginstitute.com. Okay, guys, so without any further ado, let's get started. First question. A client with acute asthma is treated for inspiratory and expiratory wheezes and a decreased forced expiratory volume. Which class of prescribed drugs should the nurse administer first to this client? 1, oral steroids, 2, bronchodilators, 3, inhaled steroids, or 4, mucolytics. And guys, the correct answer is 2, bronchodilators. Why? Go back to the question. It says the patient's having wheezing. What is wheezing, guys? Wheezing is the sound of air trying to force itself through a narrowed airway. Okay, so we know there's some kind of bronchoconstriction going on because that airway is not open. Otherwise, we wouldn't be hearing wheezes. So we're hearing wheezing, and look at what else it's saying: decrease expiratory volume. That patient cannot get that air out. So what are we going to give them? A bronchodilator that's going to open the airway so we can get lots of oxygen coming in and that CO2 going out. So the correct answer is 2 bronchodilators. Now let's talk about the wrong answer choices. 1, oral steroids. 3, inhaled steroids. The oral steroids and inhaled steroids, guys, remember what steroids are good for. What? Inflammation. So we can give that to decrease inflammation. Wonderful. But we're going to give that after we give that bronchodilator, because at the end of the day, who cares about inflammation if their airway is still obstructed? That patient's not going to be able to breathe. Who cares about inflammation if the patient's dead? So the first thing we want to make sure is that the patient's actually getting oxygen. We want to open up the airway. Then after we make sure that that airway's opened up by giving them that emergent bronchodilator, then we can go ahead and give them steroids to decrease inflammation. Wonderful. But that's not our priority. Our priority is giving them what? A bronchodilator to open up the patient's airways. Now, number 4, a mucolytic. This patient's having an asthma attack that has nothing to do with excessive mucus production. The problem in an asthma attack is not, making too much mucus that's clogging up the airway. That's not the problem. The problem in asthma is constriction of the airway. Okay, so mucolytic, that's not going to help the patient because, like I said, what this patient's experiencing is an asthma attack. So that's why number 2 is the correct answer. The nurse is admitting a client with asthma who's to be started on Theophylline. Which of the following questions would be appropriate to ask the client? 1, are you a diabetic taking insulin? 2, do you take cimetidine Tagamet? 3, do you use aspirin on a daily basis? Or 4, do you exercise routinely? Okay, guys, and the correct answer is 2. Do you take cimetidine Tagamet? Why? That medication, cimetidine, that's an H2 blocker. And what happens is that medication can decrease the excretion of this medication and actually cause theophylline overdose, theophylline toxicity. So all the other choices, that's really not relevant to theophylline. But that H2 blocker, it absolutely is, because think about it, guys. If the patient cannot clear that medication, which means they cannot get that medication out of their body, what happens? It builds up and builds up and builds up and builds up. And before you know it, the patient can have a toxic level. By the way, guys, with theophylline, your therapeutic range for it is 5 to 10. Some books said, actually it's 5 to 15, sorry. Some books go as high as 20, so just go by what your textbook says. For testing purposes, guys, I guarantee you, I can't say for your school, but for NCLEX, I guarantee you, it's not going to be close. It's going to be way out of range where you know it or you don't, okay? All right, next question. After instructing a client to use You guys know I can't pronounce. Beclomethasone visceral inhaler. Which of the following statements by the client indicates to the nurse that the teaching has been effective? 1, I will limit myself to 2 cups of coffee per day. 2, I will take it before bed each night. 3, I will take it with meals to mask the taste. Or 4, I will rinse my mouth after each use. And guys, the correct answer is 4, I will rinse my mouth with each use. Why? This medication that we're looking at, beclomethasone, this is an inhaled steroid, right? So what are we concerned about? That patient developing candidiasis, thrush in the mouth. So if they say that after each use, they're going to rinse out their mouth, we know the teaching's been successful. It's been effective because they understand that if they don't do that, they can possibly develop candidiasis, okay? Which of the following statements made by the client indicates to the nurse that the client does not understand how to use cromolyn sodium Intal and is in need of further instructions? 1, if I don't feel better in 2 to 3 weeks, I should stop taking the medication. 2, I will call my doctor if the medication causes severe coughing. 3, I have to take this medication routinely even when I feel good. Or 4, I do not stop my other medications just because I'm taking this one. And guys, you would know that this patient needs further teaching if they say, number 1, if I don't feel better in 2 to 3 weeks, I should stop taking the medication. Guys, it takes a solid 4 to 8 weeks for this medication to be effective, for this patient to see that the medication is effective, that this medication is in their system and it's effective. Up to 2 months. So if that patient says after 2 to 3 weeks, if it's not working, I'm going to stop, that's wrong. And guys, the rule of thumb, do ever tell patients, I mean, not ever, because there are some medications we'll tell patients stop abruptly. However, let's say you don't know what the answer is and it's a medication question, right? 90% of the time, the wrong answer is when the patient says, I'm going to stop this medication abruptly. We don't like patients stopping medication abruptly. There are some situations where we will have them stop it, but just generally speaking, if you don't know what the answer is, don't choose that one. So for this situation, that is the wrong answer if the patient says they're going to stop using it. And like I said, this medication, the cromolyn, by the way, guys, that's a mast cell stabilizer. It takes a solid 4 to 8 weeks before it's actually effective. Now, choices 2, 3, and 4, these are all correct. These are good, and that's why we didn't choose them, because the question's asking us which one needs correction. Next question. When instructing a client to use a meter dose inhaler, it would be essential for the nurse to include which of the following aspects? Instruct the client to 1, hold the breath for 3 seconds after using the inhaler. 2, take quick, deep breath after activating the canister. 3, activate the canister at the beginning of a slow, deep breath. Or 4, place the canister 6 inches in front of an open mouth. And guys, the only correct answer here is number 3, activate the canister at the beginning of a slow, deep breath. And by the way, guys, even though, yes, that's correct, but following up with that, how long do you want the patient to hold their breath? For a good 5 to 10 seconds. Okay, now let's look at our wrong answer choices. Number 1, hold the breath for 3 seconds. Well, you know that's wrong. I just told you how long? 5 to 10 seconds. Number 2, take a quick, deep breath. No. They need to take a slow, deep breath. Number 4, place the canister 6 inch. Stop it. Stop it. You're going to have that client place the canister half a foot away from their mouth. The air is going to be getting that medication, not the patient's lungs. Okay, so number 4 is wrong. No, they're not going to do it 6 inches. It's going to be 2 inches away from the mouth. So the correct answer is number 3. The nurse selects which of the following inhalation drugs for inflammation. Select all that applies. Guys, how do we treat select all that applies? As true or false? Let's go. Number 1, cortisone, which is cordone. False. The question, guys, is asked. Go back to the question. Look what it says. It says inhaled drugs for inflammation. Number 1, cortisone. What kind of drug is that? That's a systemic drug. It's not inhaled, so that's wrong. Choice number 2, belomethasone, your beclovent. Absolutely. That's inhaled steroid for anti-inflammatory, but it's inhaled. Very good. Choice number 3, dexamethasone. That's our Decadron. False. How's that taken? Nasally. It's not inhaled. Nasally, so that's false. Choice number 4, flunasolid. Guys, you know I can't pronounce, but that's your Aerobit. Okay? Absolutely true. That is inhaled. Your Aerobit is true. It's inhaled. 5, prednisone, your Deltazone. False. That's a systemic drug. And choice number 6, triamcinolone, Asthma. True. That is inhaled. So your inhaled medications are number 2, 4, and 6. A client with asthma awakens in the middle of the night with an asthma attack. Which of the following inhaler medications should the nurse administer first? 1, albuterol proventil. 2, triamcinolone acetonide, Asthma. 3, fluticasone propionate, Flovent. Or 4, cromulin Intal. And I know you guys all know the answer to this because you do not want me to have a heart attack. The patient wakes up in the middle of the night and they're having an asthma attack. What is it that we have to give to that patient when they're having an asthma attack? A SABA, a short-acting bronchoagonist. We need to give them something to open up those bronchioles immediately, guys. This patient can't breathe, so we're going to give them albuterol. Albuterol is a short-acting bronchoagonist, and that is what you give a patient when they're having an asthma attack. Number 1 is the correct answer. After a client diagnosed with pneumonia has an episode of respiratory distress, the client's intubated and they're placed on a ventilator. The breath sounds are diminished and the chest x-ray shows lower left lobe consolidation. The physician orders respiratory treatments with acetylcysteine Mucomyst. The nurse should monitor the client for which of the following results from this treatment? 1, bronchodilation. 2, increased sputum removed with suctioning. 3, decreased level of consciousness. Or 4, hypotension. And guys, the correct answer is 2. What is Mucomyst? Mucomyst is a mucolytic, so it breaks down those thick, viscous, tenacious sputum. It breaks it down so the patient can expectorate it. So the patient can expectorate it more. Okay? But look, in the question, it says that the blah, 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 da, da, da. The patient's intubated. So are they going to be able to expectorate all that thick sputum? No. That's why it says with suctioning. Did you guys catch that? Did you guys catch what just happened here? So you should know what Mucomyst is. Let's say you didn't catch that part. But guys, your critical thinking should have still came in and you should have said to yourself, well, this patient is intubated. Well, it makes sense that they need that thick sputum removed with suctioning. Then we go ahead and choose that answer. Let's say you didn't even catch that. You had no idea what the answer is. If you go back to the question, it says you're going to monitor for which result. It didn't say which adverse effect. It didn't say side effect. It said result. Result is something that we want to see happen. So even with that one word result, you should have gotten rid of number 4, hypotension, because that's not a good thing. That's not something we'd want to see happen if we gave a patient a medication, even if we didn't know what that medication was. It could be number 3, decreased loss of consciousness, because that's not a result. That's not something we would want to see happening after we give a patient medication. So you should have been between 1 and 2. If you had no idea what the answer was, at least you improved your chances of getting the answer correct. Okay. But by the way, again, guys, Mucomyst, it's a mucolytic agent. Very important for you to know. It breaks down those thick mucus plugs, so that if the patient's not vented, they can just cough it up. But if they are vented, it'll be easy to suction it out. Next question. The nurse is caring for a client with lung cancer who has intractable cough and is exhausted from the effort of coughing. Which of the following drugs should the nurse administer to the client? 1, rifampin. 2, Mucomyst. 3, Flovent. Or 4, codeine. I love this question. And guys, the correct answer is codeine. And I know what you're thinking. You're like, wait a minute. This patient's having respiratory issues. I know that narcotics decrease the respiratory system. Why would we give them codeine? Well, codeine specifically, guys, decreases the cough center. Remember where the cough center is located, guys? In the medulla of the brain? It decreases that cough center. Go back to the question. Look what the patient has. Intractable cough. That means that cough is not going away. They're coughing and coughing and coughing and coughing and coughing and coughing and coughing. Just that act of coughing over and over and over and over and over and over again. Number one, that patient can't breathe anyway. They can't catch their breath. They're coughing. And those lung muscles are getting tired from all that coughing. So we have to do something to stop that coughing. So what are we going to do? We're going to turn off that cough center in the brain, in the medulla. How do we do it? By giving them codeine. Make sure you guys know that, because I've seen lots of students get tricked by this one question. Yes, codeine is typically given for intractable cough, okay? And it throws students off, because codeine is the first one they want to get off the list, because they're saying to themselves, well, that's a narcotic. I know narcotics depress the respiration, so I'm not going to choose that. But for intractable cough, that's what we give, okay? And I just explained why. Now, let's talk about the wrong answer choices. 1, rifampin. Guys, that's a drug we give for TB. 2, Mucomyst. That's a mucolytic. I already explained what that is. And 3, Flovent. That's an inhaled corticosteroid. Okay? So for intractable cough, the correct answer is codeine. Which of the following treatments is the priority for the nurse to administer to a client who has a positive TB skin test but has no other evidence of active disease? 1, no treatment and repeat skin test in 6 months. 2, INH for 12 months. 3, multi-drug therapy for at least 12 months. Or 4, streptomycin for 12 months. And guys, the correct answer is INH for 12 months. Now, some textbooks vary. It'll say 9 to 12 months. 9 months is the minimum that the patient can be on, but the range is 9 to 12 months. And so for our choices given here, it is 12 months. I really don't like this question or how it was set up, because if a patient's skin test is positive, what are we going to do? We can do an x-ray, but does an x-ray confirm tuberculosis? Absolutely not. There is only one diagnostic test. There's only one thing you can do to 100% confirm and diagnose a patient with tuberculosis, and that is a sputum culture. It's a sputum culture. It's not a skin test, also known as Mantoux test, also known as PPD, okay? And it's not a chest x-ray. The only way you can confirm that a patient has tuberculosis is by a sputum culture. You want to get that sputum culture early in the morning before the patient eats anything, okay? All right, next question. The nurse is caring for a client who has chronic obstructive pulmonary disease and pneumonia. After being extubated, which of the following orders should the nurse question? 1, continuation of current antibiotics. 2, oxygen per nasal cannula at 6 liters per minute. 3, out of bed with assistance. Or 4, continuation of nebulizer treatment. And guys, the correct answer is giving that oxygen at 6 liters per minute. We're going to question that order. We're not going to give that COPD patient high flow oxygen, okay? We're not going to give them more than 3 liters. Everything else is good. Let's look at our other choices. 1, continue antibiotics. Absolutely, because what does it say in the question? They also have pneumonia. So we're giving the antibiotics not for the COPD, but for the pneumonia. Out of bed with assistance? Absolutely. Why? You get that patient moving out of bed. They're going to be doing what? Breathing in oxygen. They're moving. And matter of fact, guys, this is why we get patients moving, to prevent them from getting what? Pneumonia. When we get them out of bed and we get them moving, we're trying to prevent them from getting an infection such as pneumonia, infection in the lungs. So getting them out of bed, that is a priority. We want to clear up that pneumonia. And what's our next choice? 4, continue current nebulizer treatments. Absolutely. The nebulizer treatment, that is for the COPD. And that's going to help them breathe better. So the one that you are not going to do is choice number 2. You're not going to give patient high flow oxygen. With a COPD patient, you're not going to give them more than 3 liters. It is essential for the nurse to use humidification for an oxygen flow rate of greater than what flow per minute to prevent drying of the mucous membranes? 2. Anything higher than 2 liters, you have to make sure they're getting humidified oxygen because it's very drying to the mucosa. And what you'll start to see is cracks of the inner nares, and they can even start getting nosebleeds. Okay? So 2 is the correct answer. The nurse is preparing to teach the class on appropriate use of nebulizers and meter dose inhalers. Which of the following should the nurse include in the class? 1, MDIs require a gas flow rate of 6 to 10 liters per minute. 2, nebulizers deliver medication through a face mask or mouthpiece. 3, nebulizers deliver dose in puffs. 4, meter dose inhalers require refrigeration. And guys, the correct answer is 2. Nebulizers deliver medication through a face mask or mouthpiece. That's the only one that's a correct answer here. Let's talk about the wrong answer choices. 1, it says MDIs require a gas flow rate of 6 to 10 liters. No, nebulizers. It's nebulizers that require the gas flow rate of 6 to 10 liters per minute. Choice number 3, nebulizers deliver doses in puffs. Meter dose inhalers, MDIs, those are the ones that deliver doses in puffs. And by the way, guys, if a patient's using an MDI, the protocol, they're going to use 2 puffs per administration. Choice number 4, MDIs require refrigeration. That's false. No, they don't. The nurse selects which of the following types of low flow wait, I'm sorry, guys. I have to go back and read that. The nurse selects which of the following types of low flow for oxygen therapy. Select all that applies. How do we treat select all that applies? As true or false. So we're looking for low dose oxygen, low flow oxygen, excuse me. 1, Venturi mask. False. That's high flow. 2, aerosol mask. False. That's also high flow. 3, nasal cannula. True. That's low flow. 4, non-rebreather mask. True. That's low flow. 5, transtracheal. False. That's high flow. 6, a simple face mask. True. That's low flow. So for this question, the correct answer is 3, 4, and 6. The nurse is instructing a client on the proper use of pump for nasal spray administration. Which of the following statements by the client indicates a need for further instruction? 1, I should clear my nasal passages gently before using the pump. 2, I should inhale deeply during administration of the medication. 3, I should prime the pump if it hasn't been used for more than 24 hours. 4, I should not inhale during the administration of the medication. And guys, the question that requires further teaching, or the one that's wrong, is the one that says I should inhale deeply during administration of the medication. Go back to the question. What kind of medication is this? A nasal spray. So why are you breathing deeply? You want that medication to get in your lungs, or you want it to go in the nose? It's nasal spray. We want it to stay there in the nose. So why are you breathing in deeply? We're trying to get it absorbed here in the nasal passages. So that's the one that's incorrect, okay? We want the medication to remain in the nasal passage right here. It said right there in the question, pump for nasal administration. Okay. Next question. The nurse is admitting a client who was recently diagnosed with asthma and has been taking a long-acting Theophylline. After reviewing the client's history, the nurse discovered that the client has a manic disorder controlled by lithium. Which of the following is a priority for the nurse to include in the client's treatment plan? Guys, this is a famous nursing test question. You better know this. 1, increase the dose of lithium. 2, obtain a serum lithium level. 3, increase the dose of Theophylline. 4, obtain a consult for psychiatric consultation. And guys, the correct answer is 2, obtain a serum lithium level. Theophylline increases the rate of excretion. So what happens is the patient may end up getting a subtherapeutic level of lithium. That is very bad. Lithium has a very narrow therapeutic range, guys. 0.6 to 1.2. 0.6 to 1.2. That is the therapeutic range. So you have to be very careful with that. So you notice that, okay, we've been giving this patient theophylline, but they're on lithium. You better draw that patient's lithium values to see what their lithium level is, because we need it where? 0.6 to 1.2. Something else, we're speaking of lithium, this has nothing to do with respiratory, but since I mentioned lithium, to watch out for. Something else, if you guys get a question about patients on lithium, if they're, where was I going with this? Oh, you need to make sure you're looking at the patient's sodium level, because that patient having hyponatremia can cause their lithium level to be too high. And if they have hypernatremia, they can have a subtherapeutic level of lithium. So they love asking about that as well. Okay, moving on. I digressed for a minute. Oh my goodness, guys, we're already down to our last question. Guys, I'm so excited. This is the first time that I've been allowed to wear makeup in a month, and I'm kind of rusty, but I'm happy. All right. The nurse is collecting a medication history on a client admitted with asthma who's been taking theophylline. Which of the following drugs is a priority for the nurse to notify the physician that the client's also been taking for a urinary tract infection? 1, Velocef. 2, cephalosporin. Guys, I cannot speak. Cefadil. Let's just stick to Cefadil. 3, Bactrim, or 4, Cipro. And guys, the correct answer is 4. Why? Cipro can cause theophylline toxicity. Remember, guys, I told you the normal range is 5 to 15. Some books will say 20, so go buy your textbook. But 5 to 15 or 20, that is your normal range. But Cipro can cause toxicity. Why? Because if the patient's taking Cipro, they might not be clearing that medication the way they're supposed to. Where's the medication's being cleared? It gets broken down in the liver, right? The liver metabolizes the medication, and we clear it through what? The kidneys. Right? But the patient taking Cipro, the patient might be holding on to that medication, and it builds up and builds up, and the patient might go through theophylline toxicity. So that's also very important for you guys to know. Guys, that's the last question. I hope you found this video to be helpful. Please don't forget, guys, I have so many audio lessons available on my website right now, nexusnursinginstitute.com. And every week I add even more lessons. If you're still hungry for content, make sure you check out my lessons on my website, nexusnursinginstitute.com. Make sure you head over to my TikTok, where I cover about 3 to 5 questions a day, Nexus Nursing, and also Instagram, Nexus Nursing. Guys, oh, one more thing. Don't forget about my podcast. I have podcasts for my nurse practitioner students or new graduates. If you're ready to take your test, or you're in school and you're studying, I have a podcast. It comes out the same day and time as my YouTube videos, Sunday, 1 p.m. I'm on Stitcher, Spotify, Amazon Music, what's it called? Google Music? I'm on like 12 different platforms. So just look for Nexus Nursing. If you can't find it, I also have my podcast on my website as well, nexusnursinginstitute.com. Thank you so much for spending this time with me, and you'll see me on the next video.